Hi, I'm Dr. Susan Oakley. Thank you so much for watching. I practice in Wellington, Florida, and I'm board certified in equine sports medicine and rehab. What I'd like to talk about today is biosecurity at horse shows. What does that mean? Why do we do it? And how do you do it? Everybody has certainly heard of the equine herpes outbreaks. And that's one of the most common reasons that we have heightened biosecurity, because the disease of neurologic herpes is absolutely devastating. And there are other diseases that are easily transmissible with large groups of horses. So we want to be able to have protocols that allow for us to show our horses, interact with other people, but not take any diseases home, and hopefully keep our horses very healthy while they're showing. So there's measures that reduce the risk of introduction of diseases. You want to make sure that your horses are healthy when they're transported. So you want to monitor the temperature twice a day for 3 days before the show. If anything over 101.5 is a fever, and maintain current vaccines. Flu and rhino are required every 6 months for USEF, and be sure your horses are up to date. Many showgrounds now also require certificates of health so that your horse has been inspected within 14 days of showing. The purpose of that is to try to minimize the number of horses that are sick that are transported to shows. So diseases, there are many modes of transmission. Fomites, which I always thought was an interesting word, but they are inanimate objects that can transmit disease. Can be your clothing, could be a trailer, tack, brushes, buckets, anything that's a physical object that can have a bacteria or virus live on it, and another horse can come up and become infected with that disease. So you can have direct contact with an infected individual. If your horse is nose to nose with a horse that's sick and coughing, you have a pretty good chance that your horse may get sick as well. Now, airborne transmission means the horse could be in the other end of the barn and coughing, and then your horse can inhale droplets from the air and become exposed that way. Vectors are living organisms, such as people, or in the case of diseases such as equine encephalomyelitis, the vectors are mosquitoes. Tick-borne diseases, the vector is a tick. So living organisms can transmit disease. Although fortunately for us, in this country, in the US, there aren't any diseases that horses get that we can get as well, respiratory-wise. So regardless, we can transmit other horses' respiratory diseases to our horse. And there's also oral transmission. Fecal oral transmission is a very common way of transmission of salmonella bacteria. The common infectious agents that we're going to talk about that you're most likely to be exposed to at a horse show or any gathering of horses would be equine influenza virus, also abbreviated as EIV, equine herpes virus, abbreviated as EHV, strangles, and salmonella. And again, fortunately, salmonella is the only one of these that is transmissible to humans. Equine influenza virus is highly contagious and has a high rate of transmission. It has a short incubation time, 1 to 3 days, but they can shed virus up to 14 days. So your horse can be back to normal, not coughing anymore, and still shedding virus. It can spread 150 feet by coughing and also by contaminated hands, tack, and clothing. And many horses are asymptomatic shedders. In other words, they carry the virus, they get the virus when other horses get sick. They don't actually get sick, but they can shed virus and transmit it to your horse as well. Vaccines are very effective. They've had outbreaks in other countries where equine influenza was not native, and it can be a very devastating disease. So it's very important to keep all of your horses vaccinated and up to date. The symptoms of equine influenza are very similar to the symptoms of human influenza: cough, nasal discharge, fever, and lethargy. And the cough is one of the most prominent signs with this disease. But they usually have symptoms 3 days or less. Again, they can transmit virus much longer than that. The virus causes damage to cells in the throat and the lungs, which takes 3 weeks to regenerate. So even though they're not coughing anymore, they're still not able to fight off other bacteria or viruses. So they're susceptible to secondary infections or pneumonia for 3 weeks after infection. So something very important. And that's an electron micrograph of an equine influenza virus. Equine herpes virus, or more commonly known as rhino, there are multiple herpes viruses. It's a type of virus, but the EHV1, 80 to 90% of horses are exposed by the time they're 2 years old, by their 2-year-old year. And subclinical carriers can shed the virus. In other words, horses that are never sick can still have the virus and transmit it to others. EHV1 has 4 forms. There's the respiratory, which is the most common sort of snotty nose condition that we're familiar with. It can cause neonatal illness and abortions, a very common cause of abortion on breeding farms. And the most dreaded and feared form is the neurologic form, which is called equine herpes myelopathy. MYEL, myel means spinal cord. So some horses get the neurologic form and some don't. And there's no way to know which horse is going to get it. It is spread by direct contact, contaminated hands, and aerosol, but only for 30 feet, whereas the influenza virus was spread by aerosol up to 150 feet. So horses in the next barn are not likely to be contaminated by a coughing horse. So in other words, 3 stalls down, your horse isn't going to breathe the droplets of the rhino horse that's sick with rhinopneumonitis and get sick from that. More likely contaminated hands, pitchforks, anything else that touches horses. And it also survives in the environment 7 to 30 days, but it is very susceptible to disinfectants. And this is an electron micrograph of the equine herpes virus. The neurologic form causes equine herpes myelopathy. Its incubation period for this disease is highly variable. Averages 4 to 7 days, but it can be up to 14 days. So your horse could get sick 14 days after exposure, which is why this disease can be very devastating, because your horse could go to a show. It could be next to an asymptomatic carrier, and your horse might not show signs for 2 weeks. And by then he's back at home and able to expose a whole lot more horses. So the initial clinical signs are very nonspecific, may or may not have a cough, whereas influenza almost always has a cough, nasal discharge, and may have a fever. If neurologic signs occur, weakness in coordination, difficulty urinating or defecating, and difficulty standing can be observed. And definitely the difficulty urinating is a common sign with this neurologic problem. With the equine herpes virus, most horses show only fever and possible nasal discharge. But there's a different strain of herpes virus that has the neurologic strain that has a 30 to 50% mortality rate, which is pretty terrifying. And horses that get the equine herpes myelopathy, those that remain standing have a better prognosis. And the treatment is only nonspecific. It's supportive care, IV fluids, anti-inflammatories, and sometimes the antivirals are tried. So there is no vaccination for the neurologic form of herpes. It's a very important thing to realize. There's no way that we can vaccinate and prevent the neurologic form. So when we're vaccinating our horses for herpes, what we're doing is we're decreasing the respiratory symptoms and we're decreasing the shedding of the virus. So respiratory shedding can result in other horses getting the neurologic form. It also decreases abortions in pregnant mares. And so recommended vaccination interval is 6 months and required for showing unless you have a statement that your horse has severe reactions to the vaccination. Strangles is the most common infection in horses 6 to 10 years old worldwide. It's a highly contagious bacterial respiratory infection, whereas flu and rhino are viruses. Strangles is a bacterium. It is characterized by lymph node swelling and abscessation. The full on the picture on the bottom right has just classic swelling of lymph nodes and strangles. You usually get a fever 2 to 3 days post-infection, lymph node swelling about 7 days post-infection. Can have variable signs, but very often fever, thick nasal discharge, anorexia, and lethargy. In other words, they're off their feed, they don't feel well, they have terrible snotty nose, and the fevers are often quite high. 104 is not uncommon with this disease. So it's spread horse to horse by direct contact, drinking contaminated water, or fomites, which again is any inanimate object that is near the horse that horse touches, and then it goes to another horse. So if your horse is wearing boots to work, and then he has a little bit of a snotty nose when he comes in that day, he rubs his nose on the boots, you use the boots on another horse, they rub their nose on it, that horse can get sick. So strangles persist in the environment 34 to 72 days, so it's quite long lasting. And up to 10% of horses develop persistent infection and can shed bacteria for 30 days after they're recovered. And there are also some horses that are carriers that have no symptoms, but they carry the infection in their guttural pouches. When your horse is ill with strangles, supportive treatment is recommended. And we generally don't use antibiotics unless there are complications. But antibiotics can prolong the course of the disease. Vaccines are available, but they often have side effects that can be almost as bad as the disease. So we tend to vaccinate if there's a problem in the area. So for example, if the show circuit that you go on is known to have cases of strangles, then you should vaccinate your horse. But it is not necessarily in the routine vaccination of most horses. Salmonella is another bacterium to be feared. It is a GI bacterial infection. The most common one is Salmonella enterica, enteric meaning intestine. And stress is a contributor to the disease. It has fecal oral transmission. In other words, you have to have contact with animal feces in order to transmit it. Symptoms can be diarrhea, fever, lethargy, anorexia, and colic. In other words, they don't feel well, they can colic, have a fever, and they can have very severe diarrhea. This can be a very difficult condition to treat, requires the horse to be in isolation, and it's very important to remember that it is a human pathogen as well. So you should wear protective equipment, you should wash your hands religiously, and make sure that you don't transmit it to anyone, including yourself. So how do we prepare before we go to a show? So the most important thing is to follow vaccination protocols, have proof of a negative Coggins test, and then travel with your documents, Coggins, health certificates, proof of vaccination for all horses. And if you're going to a show grounds that is requiring a certificate of health, make sure you have that done as well. And then know your horse's baseline temperature and know how to take a temperature, because when you're at a show, you may need to take temps twice a day. So the USEF policies are that horses entering premises must be accompanied by a valid health certificate. Especially if you're out of state, you have to be have a certificate of interstate health certificate. You should have flu and rhino vaccination documentation within 6 months, and any temperature above 101.5 needs to be reported to a veterinarian or competition management. Precautions to take. So these are some very simple and very, very, very important things that you can do to protect your horse. So don't share water buckets. So, don't share feed buckets. Don't share anything the horse's nose is on. Also, pitchforks. That can, if there was a horse that had salmonella and the you borrowed someone's pitchfork and then that got in the hay in your horse's stall, you could transmit it that way. A big one is don't submerge water hoses. There have been cases at universities where they had salmonella outbreaks and they traced it back to the person watering was putting the water hose down in the water bucket. Now, it's a lot easier to do that and walk away and do something else because it can be kind of boring standing there filling up a water bucket. But for your horse's safety, do not dip the hose in the bucket. It's one of the most simple things you can do. And you're not likely to get in this situation at a horse show, but often in trail riding situations, because a lot of the horses that show also go on trail rides, they it's very common to have a communal water tank, and then the horses often will drink next to each other. So you really want to avoid horse to horse contact and limit human to horse contact. Often it shows there's people walking around, and sometimes they're not horse people and they want to pet the pretty horses. But one of the worst things you can do is walk down a barn aisle and pet every horse's nose, because then you will absolutely be sure that they're all exposed to the same things. So avoid sharing brushes, don't share towels, certainly don't share bits. If you absolutely have to, make sure that you disinfect it in between horses. And again, with stall cleaning supplies, it's really best to keep your own, but if someone really needs to borrow it, disinfect it before you use it on your horse or your horse's stall. Other precautions are wash your hands between handling different horses, and don't hand graze where other horses have been. It's very tempting at a show. We take our horses out, they've been locked up in the stall all day long, and we want to hand graze them. But if everyone is grazing in the same place, then if one horse passes manure that is shedding salmonella, your horse could be exposed to that. Or if any nasal discharge got onto the grass, then your horse could be exposed to a lot of other things. And avoid hauling horses outside your barn. So in other words, if you board your horse at one barn, the horse is already exposed to pretty much everybody that's in your barn. But then if you take someone from the neighbor's barn, they may not have been exposed to that horse. So there's more chance of spreading disease that way. And then wash your clothes. If there's been any outbreak, be sure to disinfect your boots when you're going back to your barn, because we can track all these things through with our boots. And returning home from a show, when it's possible, you'd like to isolate your horses from other horses that remained at home. Monitor your horse for signs of fever, nasal discharge, cough, loose stools, or overall lethargy and weakness. And disinfect the trailer and items used at the show. And it's actually best to have a separate set of items, a separate set of buckets and stall cleaning utensils, and separate set of everything except your saddle and bridle, probably, to use at the show that can just stay in the trailer and therefore not bring things back and forth. So how do we disinfect? The really important thing is most disinfectants will not go through organic debris. In other words, dirt and manure and grass and feed. So you need to wash, say you're going to disinfect your bucket, you need to scrub it first. You get all the food and any manure off the bottom, or any organic debris has to be taken off. Then you let it dry, and then you disinfect it. So it's a 3-part series. And you can use a 10% solution of bleach and water, but bleach and chlorhexidine, which is the Novosan brand, are both inactivated by organic matter. So if you spray the stall that you're going into with bleach and it has dried up manure on it, it's not going to disinfect that. So stokenviron, synphenol, or intervention are all disinfectants that you can find that should be used when there's organic matter present, where you can't actually clean the debris off of what you're disinfecting. It's not that difficult to disinfect a plastic bucket or a metal bit, but these wooden stalls with dirt floors that we often run into at shows, they can be a little more challenging to disinfect. So that is just the tip of the iceberg, but that's a bit of an introduction to, biosecurity and how can we keep our horses safe. If you'd like updates for the latest outbreaks of what's happening anywhere in the US, you can go to the Equine Disease Communication Center, equinediseasecc.org, and they have current outbreaks of, if unfortunately there's an EHV herpes outbreak, then you can have the latest details on what's going on with that. So again, the points of how to prevent disease: vaccination, sanitation, in other words, keep everything clean, separate items for the show and at home, and then risk assessment. If there's a big outbreak at a show and it's known, then you're probably better off scratching from that show. Or if your horse is a little bit under the weather and you're not sure if he's sick or not, it's better to scratch, leave him home, than take him and expose other horses. And then monitor. You want to keep a log on your stall of the horse's temperatures so that it can be spotted very early. And if there is a disease outbreak, it can be localized and quarantined very, very quickly to minimize the number of horses that are exposed. So again, how do we respond to it? We quarantine them, we monitor, sanitation, of course, and proper protective equipment so you don't transmit it to the next horse, and communications. We need to let people know what's happening, and the EDCC is a great way to keep on top of what's going on if there is a disease outbreak. So thank you for listening, and this was just a little introduction, but please feel free to research some more. But that's basically the procedures that you need to follow while going to a horse show to keep your horse happy and healthy. So thank you again for listening.